Good afternoon, everyone. I'm going to go over a few tools today during a little lunch and learn. So we're going to be talking about tools for making data-driven decisions during COVID-19. I know in particular, I am always looking for good information on how I make either business decisions or my own personal decisions. So I found some really great resources that thought I would share with you today so that together we can all make better decisions, particularly during the pandemic and as there's phase reopenings going on in our communities and cities across the United States. So today we're going to be talking about those tools. So to begin with, for those who don't know, I'm Anna Delernia and I run Level Up Impact Group, which focuses on really helping people ask the right questions. And I come at this from a very strategic point of view, having 10 years of experience in healthcare and philanthropy and education. So I have a bit of a mosaic career that helps me help other people do what they can do best. So I'm happy you're here and joining me today as we talk about what resources are really out there to make those data-driven decisions. So today I'm going to go over some 3 tools that I personally have found very helpful, and they're all evidence-based, backed by science, backed by robust data. So these are legitimate tools that can help you make decisions. So those 3 are, the first one is going to be thinking about what your risk score is for COVID-19. So Mathematica put out this risk score assessment that uses evidence-based tools. The other will be around how our community behavior is changing. And we're going to take a look at Google data in that case. And the other will be around progress towards reopening. There are already guidelines on what and how states and cities can reopen based on certain factors. So we're going to go over those and take a look at the current data. So taking a look at the current data, there's this great tool from COVID-exitstrategy.org, and it uses the CDC White House guidelines on the phase reopening approach. And those things track things like, are you decreasing your COVID cases? Is your healthcare system have the capacity if there is a spike in cases, particularly in the ICU? Does your hospital systems have capacity to take on new patients? And the other is robust testing for COVID-19. So the first tool we're going to take a look at will be this one, so you can see what your state looks like. And I'm going to go ahead and take a look at it. I have it open so you can see how it looks. So this is their website, COVID-exitstrategy.org. And they are updating this. This is a new tool, but really good guidelines. And again, they're mapping existing data to the CDC guidelines on reopening. So I live in Florida, so you can see Florida is considered red. They're trending poorly towards the guidelines of reopening. And this changes every single day based on new data that's available. So I know New Mexico has actually been green for the last few weeks. So they've been making really good progress. But Florida, we've been edging towards red and yellow for the most part. And if you want to take a closer look, you can see kind of why. So it tells you a little bit here, the summary, but I actually like the more detailed information. If you scroll down, you can see the more detailed information about your state. So I live in Florida. The trends for COVID positive cases has been increasing in the last 14 days. So they're doing a rolling 14 days. So there have been, the most recent data they have has 754 new cases, which is up from 584. And this is a rolling daily 14 average. So just give you a sense, it's increasing, right? And we want to see it decreasing according to the CDC guidelines. They're also tracking, besides COVID, flu-like symptoms. And according to this, there's not a large amount of them. They're saying we're at a level 1. Our ICU availability is good. They want it to be less than 50% for us to be, showing we have lots of ICU capacity. And our testing is getting there. So Robust testing is is the gateway criteria, meaning we're testing a lot of cases all the time. So they're saying 500,000 a day. So we're almost there. So that's good. And our positive rate is decreasing. The biggest problem is just we're getting new cases. So that's the thing that's making us red for the most part. And our testing isn't quite there yet. So again, this tool would help you just decide, like, to see, okay, how overall is my state doing towards these criteria. And if you're in New Mexico, you probably would start to see different policy changes happening because the criteria is being met. So you're probably going to see a lot more businesses being reopened. You're going to probably see movie theaters reopen, things of that nature as your state starts becoming more and more green, right? Which means that there's less, they have the situation, the safety guide rails are in place so that people can start to get back to the new normal, right? So I think this is like a handy way of taking a look at what the policy making might look like for your state and how you as an individual can be like, okay, well, that's what's going on in my state, right? Just a good overall view. Okay, so that's one tool. Again, I think it just gives you like top of the line, what are the 3 areas. Now the other one that I want to go over with you all is I think the number one question I ask myself is like, what's my own personal risk, right? Like, we know things are reopening, but as offices, particularly, I know I'm hearing a lot of offices are starting to try to reopen and start having their employees come in starting in June under different, guidelines, social distancing in place, et cetera, et cetera. But if you don't know your own personal risk for contracting COVID-19, I think that's a hard choice for you to make. So you should make a smart choice based on your own individual factors, because we know that there are age, gender, pre-existing conditions significantly increases your risk. And we also are knowing race, but this tool doesn't have race in it yet. So all those things really influence how you might go about your day, particularly as things start reopening. So let's take a look at this tool, which is produced by Mathematica. Again, this is evidence-based. It is produced by data scientists and epidemiologists using robust data sources like the New York Times case data, research data on figuring out risk scores, all kinds of really great, robust research went into the development of this tool. And I find it really helpful. So we're going to take a look at this one, which is 19andMe, which is your COVID risk tracker. And I highly recommend going in here and figuring out what your own risk is. So when you go in, they'll have a disclaimer saying it mainly works with Google Chrome. And this is not meant for medical use, but it can give you a good understanding of risk, right? So it tells you all this information and you say, okay, sounds good to me. I want to put in some information about me so I can see my score. So I'll put my own information in so we can see. So I'm female, identify as female, and I don't have any flu-like symptoms, and I do not have any underlying conditions. But if you did, you could click this and see, like, and these are based on the top conditions that influence COVID-19 risk factors. So renal disease, cardiovascular disease, diabetes, etc. So I personally do not have any of these, and I don't have any flu-like symptoms. So we're going to click next. Again, this is very simple. You can finish in less than a minute. I do live with other people. So I have, in general, I work from home. So, and I only live with my husband, so it's one person. So you guys get a general sense. So direct exposure, they're using the definitions based on contact tracing. So, and you can use this for different things, especially if you're changing your behavior. So I really enjoy, like, they have these sliders that you can have change your behavior to. So for right now, I'm just going to put in, I only come in contact to one person a week. And they define close contact as greater than 10 minutes and less than 6 feet apart. And indirect exposure would just be close contact within a week. So just indirect, right? So I do wash my hands according to CDC guidelines, and I normally wear personal protective guidelines when I go out, say grocery shopping. So I'll say yes, right? So if you calculate this, it now gives you a score, and it gives you some really, really good data. So my score out of 100 is a 36. And it tells you based because my zip code, they tell me I live in Miami-Dade County. Our cases are around 16,000, and it tells you some really good information. I think the most important one is right here. So among people who are the same age, sex, and health status as you and have behaviors and levels of interaction with others that are similar, my estimated probability of contacting, catching COVID-19 through community transition is 0.02%. So I have a really low chance of getting COVID-19 based on my current behaviors. In comparison, if I was going to catch the flu, it would be 0.41% catching the flu in a given week. So my chances of getting COVID-19 are lower than catching the flu right now because I'm following pretty strict, standards. I work from home. I don't live in a dense population, and I don't have any pre-existing conditions and things of that nature. So, but if I was to get COVID-19, my risk of hospitalization is 3.4%, and the risk of ICU is 0.95%, and my risk of dying is less than 1%. So this tells me I'm relatively low risk, right? So yay for me, but it gives me a good understanding of where I am, particularly if I'm going to be changing my behavior, right? So things start reopening, I need to start having meetings with people in person, or maybe I know Universal Studios is opening and I'm really like Harry Potter and I want to start going to Universal every week. I don't, but if I do change that behavior, my risk becomes much higher, right? So we start doing this and you say, okay, well, I actually start getting to a 2% chance of getting COVID, et cetera, et cetera. So you can change your behaviors and see how much risk this is. I personally recommend this tool for everybody just to get a sense of how they're doing, and and protect people in your family too. It's good to know, the risk factors, particularly like your parents or things of that nature. So good tool. Again, it's developed by Mathematica, evidence-based, good idea to just get a sense of how you're doing. So that was the risk calculator. And then the next one I'm going to show you is the Google Mobility Trends. And this one is produced by Google. It's not live data, but it's probably like a week delayed. And it looks at how cell phone data using Google Maps, how people are moving around their community differently since the baseline, which they have the baseline set up in January, I believe, a week of data in January. So how are people changing their behaviors? And this is handy, particularly for businesses, I believe, more so than individuals, just to get a sense of how are the changing of behavior being impacted by these decisions. So let's take a look at this tool. So this is the COVID-19 Google data. And you can see the data across the world, and you can have it by country or region. So I go with Miami, so that's where I live in Miami-Dade County, and they have it at the county level. When you do it, it gives you a PDF report. And the most recent data they have is May 16th, 2020. And you'll be able to see the different trends of how people are moving differently through the community. Again, this is not real time, but a week or so delayed, it seems. And they de-identify the data significantly, so you get a sense of how people are moving around. So since the baseline, this was collected again, this is in January, we're seeing about a 32% decrease in going to retail and recreation shops. So they're calling that theme parks, museums, libraries, movie theaters, which we know Miami-Dade just started reopening in limited capacity for restaurants. Just happened this past week, which is limited capacity. So again, that's probably not going to move until for a few weeks from now. And a number of these things aren't even reopened yet. Like museums aren't reopened and movie theaters aren't reopened yet. Groceries and pharmacies are starting to get back to like a little bit closer to baseline. So if this got to 0, then we would know, okay, we're kind of back to how people have used to move around in January. So groceries and pharmacies, again, about 12% difference from what it used to be. So people are going less, but they still are, right? Parks, still very low. around negative 28% change from the baseline. So people aren't really going to parks as much as you would think, particularly public beaches and plazas and things like that. So obviously our beaches have been closed, so that's probably a big factor that's influencing this. A huge one is transit stations. People are not taking public transit. So, and it makes sense, right? Public transit's probably it increases your chances of being in contact with other people. More people are working remotely or not working or unemployed. So this is a huge one. And that one I think is going to be a big factor going forward and how we come up with solutions for the community. And workplaces, still pretty down. People aren't traveling to work and they aren't either, or they're working remotely again. And the last is residential. So people are traveling to houses more so than they are of any other places. So that's more likely than any of the others. And actually, that's different than all the other trends. So that's more likely than before. So again, these are the 3 tools I thought would be useful for you to make data-driven decisions. I think it's always important for you to know what data is available for you and make sure you're using resources that work for you and your business and your community. So I recommend taking a look at your COVID risk score. Again, I'll go through them really quickly. If you want to take top level, that's the covidexitstrategy.org. The risk calculator is at 19andme.covid.mathematica.org. And your Google mobility trends are at Google-COVID-19 mobility. So all good resources for you to help make data-driven decisions. If you're interested in having me do this for your organization, just send me an email. I'm Anna at levelupimpact.net. I do strategy consultations and trainings for organizations focused on healthcare and education in the public sector. So I was happy to help people use data to make data-driven decisions. So again, I really appreciate you being with me today, and I hope everyone has a happy Memorial Day and enjoys this Lunch and Learn. Thanks so much.